Being sick can affect diabetes management in a multitude of ways, right?
So whether that's fevers, fatigue, dehydration, restlessness, all those symptoms that come along with having a sick day also happens to us with diabetes. But the big difference for those of us who are living with diabetes is that illness and sickness can cause blood sugars to be very out of whack. Typically we see higher blood sugars, right? But sometimes we see low blood sugars too.
The basics for everybody when you're sick, staying hydrated. It's even more important if you have diabetes.
Your body is really wise and really smart, and it's a self-healing machine. So giving it the rest and support that it needs to fight off whatever it's dealing with so that you can come back stronger, right, is really, really, really important.
When you're not feeling well, yes, we do want to check our blood sugar more frequently just to help us recover more efficiently.
So on an insulin pump, you definitely want to be checking blood sugars and ketones about every 2 hours, while on manual daily injections, you can stretch that out to every 3 hours.
I always say, when in doubt, test more, right? Now, these days, a lot of people are using continuous glucose monitors. So that means that, that machine is testing your blood sugar every 3 to 5 minutes. So you can just look at that more often.
When you're sick, your body's in this state of stress and your cells don't metabolize insulin the same way they do when you're healthy.
That then introduces the idea of insulin resistance. And so when people are sick that live with diabetes, it's super normal to find that your blood sugars just are not responding to insulin the same.
So that's where increasing our insulin levels, maybe giving more boluses throughout the day, can be a key part of treating diabetes during a sick day.
If I do have a bad cold or something like that, I do notice that it's harder to manage my blood sugars in the way that it's definitely harder to keep them down at a normal range. You're also dealing with the irregular blood sugars. You're dealing with that risk of going into DKA.
Our biggest concern with sick days is that we are more likely to produce ketones. And we think if our blood sugar's high, that's when we check for ketones. But the reality of it is, a lot of us, it's called euglycemic ketoacidosis. And our blood sugar is within a normal range, but we have very high levels of ketones. Again, this is most common to occur if you have a stomach bug, because with dehydration, those ketones really rapidly produce.
I remember the first time I had the stomach flu, it was when I was 11, so very newly diagnosed with diabetes. And so we turned my insulin off. Well, I ended up going into almost DKA again because I wasn't getting insulin and I was super dehydrated. So I ended up going to the emergency room.
If we're sick, we just can't keep enough fluids down. Once we are dehydrated, our insulin's not working efficiently, and it's just this quick, scary process that can happen, and we can quickly wind up in DKA. And there's no time frame to know when DKA would occur.
DKA, or diabetic ketoacidosis, is basically what happens when your body can't use sugar for energy, right? Maybe you're insulin resistant because you're sick, or maybe you're not eating carbs because, again, you're sick, you're vomiting, right? And your body starts breaking down fat for fuel instead of using those carbs. And so when it does break down fat, then your body releases something that's called ketones in that process. And those ketones that your body releases causes your blood to actually start to turn acidic, right? Ketoacidosis, your blood becomes acidic. And our body really does not like being acidic. So that's where it can become an emergency situation pretty quickly, needing medical attention.
As long as we're treated quickly, we're not going to have any of these long-term impacts from it. But it's definitely something that we need to take very, very seriously. And it's really difficult to decipher DKA versus just regular sickness because of how similar the symptoms can be. That's why ketone testing is so important. Whenever in doubt, that blood ketone meter is not going to lie to you. It's going to tell you if you're producing those ketones and if you need to take action.
So there is clear protocol of when to seek medical care and or emergency services when sick and when you think you might be going into DKA. The top two are always going to be profuse vomiting. So you vomited a few times, you can't keep anything down, including water, including food. That tells us that you're severely dehydrated and you need medical help. The other one is any kind of altered consciousness. So you feel really dizzy, maybe you've kind of like not passed out, but almost like as if you were sleeping and suddenly you've woken up and you're not really sure where you are. Anything that has altered your consciousness is an immediate call to emergency services as well. And that goes for any sick day plan, not just one related to diabetes, obviously. So those two, I would say, are our top two for calling 911 or going to the emergency room.
The difference between like emergency room versus urgent care. Right? Urgent care is going to be for less severe situations. If you're really concerned that something serious is going on, going straight to the emergency room, I think is a better idea, because what could happen is you could go to urgent care and then, you might spend an hour waiting, feeling terrible, having really high blood sugars, your body is going through these processes that really are very dangerous. And then they would probably just send you to the emergency room after that.
The lovely thing about diabetes is that you can't always predict when you're going to be sick or how your body is going to respond when you're sick, right? Which is why it's important that there are a lot of safeguards and planning that goes into being prepared if you do happen to get sick with diabetes.